Hey guys, Coach Adrian here with Moving Forward with Diabetes Management. So, I just wanted to talk about this topic. Just wanted to, how do I put it? Just wanted to just take a step back and really spend some time on this topic because oftentimes it's not addressed. Oftentimes people don't want to talk about it. So I wanted to take the opportunity for us to talk about it today. Okay. So just get comfortable. Let's just sit on back and really dive into depression. Let's just really dive into 3 tips to overcome depression. Now, keep in mind, I'm a registered nurse. I'm a certified diabetes care and education specialist. I am not a psychiatric nurse. I am not a psychologist. I am not a psychiatrist. But I have years of experience in dealing with and treating and caring for patients that have diabetes and also have depression. So this is a very worthwhile topic, a topic that's often not discussed in the healthcare field, but we are doing a lot better about addressing mental health and also addressing people's mental health concerns in correlation with their physical concerns. So many times you may think, oh, I have prediabetes. Oh, I have type 2 diabetes. Oh, I have type 1 diabetes, gestational diabetes. But we can not only treat the medical condition, we can't only just treat the medical part. We have to treat you holistically as a whole person. We have to treat you as a whole individual. Everybody comes with physical concerns, mental health concerns, but the great part about healthcare is we have to put all that together. We can't just only treat you for your diabetes. We can't only just treat you for your depression or your other mental health concerns, whether it's anxiety or stress, depression, bipolar, whatever it may be. We have to treat you as a whole person. So I wanted to just take the time to make sure that we discuss this because when you have diabetes, it's true. You may become very depressed. You may even have denial. You may even have anxiety, stressed out. So let's discuss the mental health portion of diabetes. Let's discuss depression. Now, depression is not the only thing that you may, deal with when you're diagnosed with diabetes, whether it's prediabetes or type 1 or type 2 diabetes, gestational diabetes. It may be denial. It may be depression. It may be anxiety. It may just be stress. It can be all of them. You just never know. Every individual is so different. But today, on this session, we're going to talk about three tips to overcome depression. And maybe not even overcome it, but definitely be able to manage it and definitely be able to deal with it so you can only not deal with your depression, but also be successful in dealing with your prediabetes. Okay, let's get started. So number 1, I always encourage people, if you're dealing with depression or anything related to your mental health, find a therapist. Okay, I know some people may say, I don't want to talk to anybody. There's nothing to talk about. What are we going to talk about? What's the purpose of us talking? I understand. Everybody, culturally, we come from different backgrounds. You may have had a therapist in the past. It may have not worked out. You may have feel like it didn't do you any good. Or maybe you've never had a therapist and you're open to talking to a therapist. But what I always say is keep your options open. Okay? Keep your options open. Maybe if you've had a therapist in the past, it didn't work out, maybe try again. See if your medical provider can refer you to somebody different, or see if there's somebody that you may know that has a therapist. And if you feel comfortable talking about it, maybe they can refer you to somebody that they know or somebody that they used or have used in the past. But definitely get a referral. Talk to somebody if you need a referral, but talk to a therapist. Talk to someone about your feelings. So it may not only be prediabetes that may be causing your depression. You may have some other life issues, some other family issues, relationship, work issues, whatever the issues may be that's causing your depression. Or even if you're feeling like, I don't feel like I really have depression. I'm just not being able to work through some things. Or maybe I'm too anxious. Find a therapist. Find somebody you can talk to. Now, I will say, for some people, they don't want to go to a therapist. And that's fine. That's your total choice. But if you have family or friend or trusted individual who you can talk to, make sure you find someone trusted that you can talk to and that you feel comfortable with in sharing your thoughts and feelings. So that's tip 1. Now, tip 2, regular physical exercise. Yes, probably not something you would think about, but regular physical exercise, amazing. It's amazing. Regular physical exercise is something that can help you with your mental clarity. It can help you sometimes just make it through the day. So if you're able to, and you have the okay from your medical provider as far as your physical recommendations and activity, go ahead. Pencil it in. Write it in. Your regular physical exercise, oh yeah, that's going to make a world of difference. A world of difference. Now, whatever your activity is, totally up to you. Totally up to you. Whatever you enjoy, make sure that you incorporate that so you can have regular physical exercise. And guess what? It's going to help you with that mental clarity. It's going to help you feel better. And in some cases, depending on if you're working on weight loss, it may be a huge asset in your weight loss journey. Now, last but not least, we're going to talk about meal planning. So, I know if you're dealing with depression, meal planning may not be the top of your list. It may not be at the top of your list. Maybe not. But I will say that if you do healthy meal planning, that is another option that can help you feel better overall. Because guess what? If you meal plan, it'll take the stress off of you. I know for a lot of people, they're like, what are we eating for dinner? What am I eating for lunch? What am I eating tomorrow? What am I eating this weekend? So at least planning can take some of the stress off of you. Now you may say, Coach Adrian, I'm depressed. I am not trying to meal plan. I hear you. But let's just think about it. This is something that you don't necessarily have to do every day. It just depends on how your life is set up. So if you want a meal plan for maybe 1 day or 2 days, or some people plan for the whole week, do whatever fits your life. But I will say that if you do the meal planning, that's one less thing you have to think about, and that can take the stress off of you. All right. So hopefully these 3 tips were helpful. Share, like, comment, subscribe to this channel. Let me know what was helpful for you. Tell me, what do you do? What do you do when you feel like you're depressed or anxious or just stressed? What do you do to manage that? Because that mental health piece is definitely one of the things we talk about in our Take Charge and Balance program. Our 12-week program that's offered virtually via Zoom. We meet once a week for 12 weeks in a group setting. No judgment, no judgment. We're here to learn and grow together. So click the links, check out the information. Let me know what questions you have. Like, comment, share, and subscribe. Share with your family and friends and colleagues. What did you learn? What was most helpful? I look forward to hearing from you. And until next time, take care, guys. Talk to you soon.